Hello and welcome to Chapter 9, Ensuring Your Health. Learning objectives for Chapter 9 include discuss why having adequate health insurance is important, and identify the factors contributing to the growing costs of health insurance. Differentiate among the major types of health insurance plans, and identify major private and public health insurance providers and their programs. Analyze your own health insurance needs and explain how to shop for appropriate coverage. Explain the basic types of medical expenses covered by and the policy provisions of health insurance plans. Assess the needs for and features of long-term care insurance. And discuss the feature of disability income insurance and how to determine your need for it. How will it affect me? Having adequate health insurance is critically important to your financial plan. The number one cause of bankruptcies for people over the age of 50 is medical expenses. Okay. So without the proper health insurance, you could face financial ruin late in life, which doesn't give you enough time to recover from it. There's facts and fantasies. Importance of health insurance. Next best thing to good health is good health insurance. Major illnesses can destroy your financial wealth. About 2/3 of bankruptcies are due to problems paying health costs. Yet about 13% of the country does not have health insurance. Now, that number is decreasing, although it really isn't anymore. It's actually increasing because if we look here, let's look here, right there. You can see on this data point, let's see. Okay, so part-time workers, for the most part, don't have health insurance. And on here, it actually has it. I'm just looking for it. I'm sorry. It takes me a minute to look. Of course, officially on farm. Dollars. Living without insurance. Right, here we go. Without insurance, 28,311,376 people do not have health insurance. Okay, while 28,311,376 people do not have insurance. 35,796,289 people are living in poverty. Now, the reason there's a 7.5 million difference is due to Medicare. Medicaid. Medicaid is insurance for people who have a low enough income to qualify. Okay? So Medicaid helps people without insurance. Medicare is for people that are over the age of 65. Okay? And that age depends on when you were born because they keep increasing your minimum age for eligibility for Medicare. Okay. U.S. retirees is 55,045,386 Americans that are officially retired, and they would be eligible for Medicare. Here's your Medicare enrollees, 60,251,857. The 5 million difference are usually people that qualify because their physical or mental status is such that they will not be able to work and actually have insurance at that point. So I used to work with people with special needs. They all received Medicare because they were mentally unable to hold a job that would provide any type of health insurance. The jobs that most of them held were part-time jobs, and many of them were jobs specially designed for people with special needs. Okay, here's your Medicaid recipients, 79.5 million people. are on Medicaid. Food stamps is 44 million, and then the millionaires are 18 million. So kind of a tale of two cities there. 18 million millionaire or billionaires, and almost 80 million people receiving Medicaid because their income is so low that they qualify for government health insurance, um, because they have no health insurance at their employer. Okay, so moving on. Causes of high medical care costs, advances in medical technology, aging U.S. population, poor demand and supply distribution of healthcare facilities, greater administrative costs, increasing regulation and compliance costs, insurance fraud, and of course the one that they don't mention is the enormous profits that the pharmaceutical companies make. So that should also be in there. And that's a statement that you may want to see if I'm accurate on. So you could Google the top 5 pharmaceutical companies in the United States, and then look at their quarterly or annual uh, return, or their statement that they release that gives an itemization of everything that happened for that quarter or that year, that they release to their, it's a publicly traded company, so they release it to their stockholders, but it's available to the public to review. Okay, so average annual premiums from 2013 to 2017. Here's the year: single coverage, family coverage. Many employers, including ECU, will cover the single coverage, but they will not cover the family coverage. And so you would have to pay the difference if you were to get family coverage, if you have children and you want them to be covered as well. A spouse would also be an additional cost. So you can do family, not including a spouse, spouse, not including the family being children, and you can also do spouse and children. Obviously, spouse and children is the most expensive. Okay, health insurance plans. Private health insurance plans available to single or families, provided as group health insurance. 2 categories are traditional indemnity, fee-for-service plans, or managed care plans. Indemnity fee-for-service plans typically offer unlimited choice of doctors and hospitals. You pay a deductible plus a percentage, typically 80% of eligible costs, reimbursement based on usual, customary, reasonable charges, and healthcare services separate from insurer. And then monthly payments, managed care plans, or monthly payments made directly to the organization that provides the health care, such as an HMO, PPO, and others. Designated doctors and hospitals provide services, so you can't go wherever you want. You have to go to the ones that are in this plan. They hold down the cost by controlling the amount of care provided and emphasizing prevention. So right there, that's kind of a warning there. By controlling the amount of care provided. So there's many things that they won't cover, in other words. Charge copayments. Most medical services include preventive and routine care, which is excellent to cover all the routine. Preventive care includes physicals and things like that. Types of managed care plans. Health maintenance organization, which is what HMO stands for, includes hospitals, physicians, other healthcare providers. Group HMOs provide services for members from a central facility. It's usually a large hospital, campus type environment. Individual practice associations, IPAs, contract with physicians who operate out of their own office and community hospitals. Okay. PPOs are also called, or preferred provider organizations are also called PPOs. Insurance company or other organizations contracts with a network of physicians and hospitals to provide services for a negotiated amount. Patient can go to provider out of network but pay a higher price. So many of you college students, if you're not from Ada or the area or Oklahoma, but you need health care, something happens and you need to go to the hospital or something like that, you might be out of network. So therefore, the payments are much higher, and the reimbursement is much lower because it's out of network. Even something simple like a dentist, if you went to get your teeth cleaned or filling or something like that, if you were in network, it may only cost $15 or $20. If you're out of network, it might cost $100 or $200, depending on what the arrangements are. So you try to always stay within your network because the costs are much less. Other managed care plans, exclusive provider and organization provides reduced cost services, but only from affiliated providers. Services from non-affiliated providers, you must pay the 100% by patient. So you're completely responsible for it. Point of service plans is a hybrid plan of HMO that allow out-of-network services paid like indemnity plan, pay a percentage of the fees. Blue Cross Blue Shield plans. Originally, plans were not insurance but prepaid hospital or medical plans. Many are now for-profit organizations that provide health insurance like other insurance companies. And of course, if they're for-profit, that means that a percentage of your premiums goes just for profits, not for health care. We are the only industrialized country in the world that has for-profit health insurance and health plans. Okay, government health insurance plans, Medicare, basic hospital coverage, Part A, supplemental medical insurance, Part B, Medicare Advantage, and then Part D, which is the prescription part. Okay. Medicaid, as I had stated, is a state-run assistance program that provides health care for eligible individuals based on income. The eligibility varies by state. More than 68 million, which we already covered that. Workers' compensation insurance, injured on the job or of work-related illness, premium paid by the employer and varies based upon claim, covers most health costs and rehabilitation costs, pay lump sum for death and certain injuries, does not apply to self-employed. So if you start your own business, you are not eligible for workman's comp. Okay, rational for healthcare reform. U.S. economy spends about 17 cents of every dollar on healthcare. Outcomes for infant mortality, life expectancy, and heart attack survival rates are worse than the average for countries who are members of the OECD. And drivers of U.S. expensive healthcare health costs are deductible for income tax only if they exceed that 12,000 or 24,000 minimum deductions, or standardized deductions. So in other words, you have to spend that much money before you can even start deducting your own taxes. Providers paid on fee for service based on this encourages unnecessary services. I suppose it depends. 2 key goals: reduce the number of uninsured citizens, reduce the increases in healthcare costs by providing a state-based health insurance exchange in each state. Changing politics, ACA in state of flux. This changes day by day. So it really, all this part here is a good history lesson of how it's changed. The Affordable Care Act has changed, but really, to get updated information, you have to go to the latest laws that are being passed and regulations that are being passed, because some of that's so accurate and some of it isn't. And if I even listed what's accurate, what's not today, by a week from now or 2 weeks from now, what I just stated might not be accurate anymore. So, and that's what this is talking about, that it's in flux. There's the provisions. Go down here, terms of coverage. And these are all the different terms of how you get covered. And there's all the different requirements. And then how to buy long-term care. Buy a policy when you're healthy, only buy coverage you need. And then you have to figure out how much you need based on what your monthly expenses are. Okay? And that's about all the time we have for Chapter 9. I'll see you on Chapter 10.